Press, I'm Greta Van Susteren. The nation hit with a brutal wake-up call. Americans terrified, markets volatile, the presidential election upended. Now President Trump among the 7 million Americans infected with COVID-19. It's no secret the president has been lax about wearing masks and social distancing. The White House is now doing contact tracing. Several members of the Trump administration have also tested positive. I asked former CDC Director Dr. Tom Frieden about the president's condition. Could President Trump have contacted this, theoretically, or anybody, have gotten COVID long before the Thursday night announcement? And how long before could he have gotten it?
You can get sick as little as 2 days after you were exposed. So it's possible he was exposed Tuesday or even Wednesday and began getting sick Thursday night and Friday. But it can be up to 14 days. That means if you're actually looking for where he might have been exposed, you have to draw that diagram for 14 days before Thursday. Any one of those days, he could have been exposed, and that might have led to his infection.
When President Trump, when it first became known that he had COVID, we heard that he had Regeneron was given to him. I assume that was done by IV, which is, as I understand it, is a lab-produced antibodies. What can you tell me about it?
So far, we've heard that President Trump has gotten 2 different treatments, both of them experimental, both of them promising. The first was a cocktail of many different monoclonal antibodies. There's only one small study that's looked at that particular product with less than 300 patients. And what it seemed to find is if you gave it to people really early, before they made their own antibodies, that those antibodies that are made in the laboratory might help them to become less ill. The second medication is remdesivir. There have been studies of remdesivir. It appears to reduce the severity of illness and make it so people spend less time in the hospital. It's not proven to improve survival, but it does appear to be helpful. Both of those are helpful early in the course of illness.
I take it that a lot of people are thinking, like, why would you give an experimental drug to the president? But I take it that there are 2 reasons that a drug is being examined. One is for danger, but the other is for efficiency or effectiveness. Do you have any information about whether there's a danger associated with these, or whether they're exploring it to see how effective?
So in terms of the monoclonal antibodies, there is limited evidence of whether it may be harmful. The belief is that it's promising. For an FDA emergency use authorization, all you've got to prove is that it may be more good than harm. That's a really low bar. But I think it's really up to the president and his doctors to make these decisions. And what I imagine they're thinking is they want a no regrets policy. They want to make sure that if there is any treatment that might improve his outcome, he gets that treatment and he gets it promptly. And in this situation, Greta, where you've got someone who's got symptoms of COVID, 74 years old, given his weight, he is in the category of being obese, and male, you've got at least a 10% risk of death without those extraordinary measures. So you want to reduce that with really good prompt care. But that also means you've got an 85-90% chance of him doing just fine. And that's what we hope will happen with the president, the first lady, and all of the people who've been infected, including last Thursday, when, by the best estimate, about 200,000 Americans became infected last Thursday, the day that President Trump did.
And does a mask protect others from you, or you from the virus, or both?
The science here is really clear. If someone who's sick wears a mask, they drastically reduce the risk to others. Don't eliminate it, but drastically reduce it. And that goes for both the big droplets and the aerosol. Even a mask that you wouldn't think would block those tiny particles will block a large proportion of them in someone who's sick. Now, does it protect yourself? Almost certainly yes. The data isn't 100% on that. And then there's an interesting theory that if you wear a mask and you get infected, the number of virus particles that you inhale is going to be smaller and you'll be less likely to get severely ill. That's a theory. There's some evidence for that. Might be true, might not be true. It's an interesting theory, not proven.